So welcome guys. In this session, we'll be looking at eicosanoids, prostaglandins, thromboxanes, and leukotrienes. Firstly, we will start with prostaglandin and thromboxane synthesis, then thromboxane and prostaglandin in platelet homeostasis. This is very important. And then look at leukotriene synthesis and its involvement in the pathophysiology of asthma. I don't want this session to be long. I want it to be brief, but to the point. Welcome all. My name is Wallace Munyiri, and I'm the Daktari. Now, let's start with an overview. Prostaglandins, thromboxanes, and leukotrienes are collectively known as eicosanoids to reflect their origin from omega-3 and omega-6 polyunsaturated fatty acids with 20 carbons. Eicosa comes from the Greek transition of 20. Now, they are extremely potent compounds that elicit a wide range of responses, both physiologic, the inflammatory processes, and pathologic, the hypersensitivity reactions. Okay, so they're involved in both physiologic and pathophysiologic processes. Now, they ensure gastric integrity and renal function. Okay, and also regulate smooth muscle contraction in the gastrointestinal tract, the uterus, the blood vessels. They also maintain platelet homeostasis. Although they have been compared to hormones in terms of their mode of action, eicosanoids differ from endocrine hormones in that they are produced in very small amounts, virtually in all tissues, rather than in specialized glands like in the hormones. They also act locally rather than being transported in blood to distant sites. Also, they are not stored. They are just like steroid hormones, but don't compare them to steroids hormones. They are not stored, and they have an extremely short half-life, being rapidly metabolized to inactive products. Now, their actions are usually mediated by G protein coupled receptors, such as your GS. Remember, GS will stimulate adenate secrease. GQ will stimulate phospholipase C, which will lead to increased levels of calcium via IP3, and also the diacylglycerol will inhibit a protein kinase. Now, to be specific, protein kinase C. Now, that is how they act. And this is how they look. Now, I want you to see the difference between prostaglandin E2, you can see it has a 5-membered ring, and thromboxane, which has a heterocyclic 6-membered oxane ring. Okay? Okay, please note that. And also, look at the leukotrienes. They do not have a cyclic ring. They are linear. Okay? Please note that. Now, prostaglandin I2 is also known as prostacyclin. Okay? Please note that. This is also known as prostacyclin. Now, prostaglandin and thromboxane synthesis. Now, arachidonic acid and omega-6 fatty acids containing 20 carbons and 4 double bonds, so it is an eicosatetraenoic fatty acid, is the immediate precursor of the predominant type of human prostaglandins, the series 2, or those with 2 double bonds. It is derived, so arachidonic acid is derived by the elongation and desaturation of the essential fatty acid, linoleic acid. It is also an omega-6 fatty acid. Linoleic acid has 18 carbons and 2 double bonds at position number 9 and 12. Remember, the saturated 18 carbon fatty acid is also known as stearic acid. The one which has 1 double bond at position number 9 is oleic. Then the one which has 3 double bonds at position 9, 12, and 15 is linolenic. This is linoleic. 2 double bonds, position 9 and 12. Okay, 18 carbons. So it is usually elongated and desaturated to form arachidonic acid. Then the arachidonic acid formed is usually incorporated into the membrane phospholipids, mainly phosphatidylinositol at carbon number 2. Then, from which it can be released by the action of phospholipase A2, which usually respond to a variety of signals such as a rise in calcium. Now, note that series 1 prostaglandins contain 1 double bond, and they are usually derived from omega-6 eicosanoic fatty acids, such as your dihomo gamma linolenic acid, whereas series 3 prostaglandins contain 3 double bonds, and they are derived from eicosapentaenoic acid. and omega-3 fatty acid. Now, here you can see the dietary linoleic 18 carbons, two double bonds at position number 9 and 12, and omega-6 fatty acid. We carry out desaturation and elongation to form arachidonic acid, 4 double bonds at position number 5, 8, 11, 14, and also an omega-6 fatty acids. Okay, then once formed, it will be incorporated into the membrane phospholipids. Then when needed, it will be cleaved by phospholipase A2. Then it will be acted upon by the prostaglandin H2 synthase, which has both cyclooxygenase and peroxidase activity to give you prostaglandin H2. Let's look at now that prostaglandin H2 synthase. Now, the first step in prostaglandin and thromboxane synthesis is the oxidative secretization of the free arachidonic acid to yield prostaglandin H2 by the prostaglandin H2 synthase, also known as the prostaglandin endoperoxide synthase. Okay, synthase, not a synthetase. Now, this enzyme is found in the endoplasmic reticulum. It is bound to the endoplasmic reticulum membrane, and it has two catalytic activities. One is the fatty acid cyclooxygenase, and this activity will require 2 molecules of oxygen and a peroxidase activity, and that peroxidase activity will require reduced glutathione. Remember glutathione has 3 amino acids, your glutamate, your glycine, and cysteine. Now, prostaglandin H2 is converted to a variety of prostaglandins and thromboxane by cell-specific synthesis. Now, prostaglandin is, as I had told you, has a 5-carbon ring, I had showed you, whereas thromboxane has a heterocyclic 6-membered oxane ring. I had showed you that. Now, 2 isozymes of prostaglandin H2 synthase, usually denoted as COX-1, cyclooxygenase 1, and cyclooxygenase 2 are known. Now, cyclooxygenase 1 is a constitutive enzyme. It's found in most tissues and is required for the maintenance of the healthy gastric tissue, also required in the renal homeostasis, platelet aggregation and platelet aggregation, whereas COX-2 is inducible. It is usually induced by cytokines, endotoxins, growth factors, also tumor products. Okay. In a limited number of tissues, is exposed to products of activated immune and inflammatory cells. Those products I've told you. Now, the increase in prostaglandin synthesis subsequent to the induction of COX-2 mediates pain, heat, redness, swelling. So these are the classical signs of inflammation. You are pain, heat, redness, swelling, and then fever of infection. Fever is especially mediated by prostaglandin E2. So here we have, you can see, we have a phospholipid, especially phosphatidylinositol. Now, we cleave at position number 2, phospholipase A2 will cleave to yield arachidonic acid. Then arachidonic acid will be acted upon by the prostaglandin H2 synthase, which has both cyclooxygenase and peroxidase activity. So once prostaglandin H2 synthase acts on arachidonic acid, it will form prostaglandin H2. Okay. Now, the cyclooxygenase activity in of the prostaglandin H2 synthase can be inhibited. So COX-1, I said COX-1 is constitutive and COX-2 is inducible. Now, COX-1 and COX-2 both are inhibited by the non-selective non-steroidal anti-inflammatory drugs, NSAIDs, aspirin, indomethacin, phenylbutazone. Then COX-2 is inducible. So it is induced by cytokines, endotoxins, growth factors, and tumor promoters, and inhibited by the selective COX-2 inhibitors, the COXIBs drugs such as celecoxib. Okay. So once you form prostaglandin H2, it can form now the various prostaglandins and the thromboxane in various tissues. Now in platelets, prostaglandin, not prostaglandin, thromboxane A2 is produced by COX-1 primarily, and thromboxane A2 will promote platelet aggregation, vasoconstriction, and bronchoconstriction. It will also mobilize intracellular calcium and promote contraction of smooth muscles. Now, in the vascular endothelium, COX-2 will be used in the production of prostacyclin or prostaglandin I2, which will have opposing effects to those of thromboxane produced in the platelets. And in that, it is a vasodilating agent and it inhibits platelet aggregation. So please note these opposing effects because these will be discussed in platelet homeostasis. Now, prostaglandin E2 is produced by most tissues, vasodilator, protects the gastric mucosa, regulates renal function, potentiates pain sensation in the nociceptor neurons. It will act on several receptors, the ER receptors, leading to phosphorylation of some receptors, allowing membrane depolarization. Okay. It is also required for fever response. Okay. Then prostaglandin F2 alpha is also produced by most tissues, causes vaso and bronchoconstriction, contraction of smooth muscles, and also stimulates uterine contraction. So it is important in parturition. Now, let's move on. Synthesis inhibition, we have said that. So I've said that. Now, please note this, that aspirin, okay, so let's just repeat it. There's no harm in doing that. The synthesis of prostaglandin and thromboxane can be inhibited by unrelated compounds. For example, cortisol, which is a steroidal anti-inflammatory drug or agent, inhibits phospholipase A2 activity. Okay, and therefore, arachidonic acid cannot be formed. Now, cannot be released from the membrane phospholipids, especially your phosphatidylinositol. Now, aspirin, indomethacin, and phenylbutazone are non-steroidal anti-inflammatory drugs, but they are non-selective in that they inhibit both COX-1 and COX-2. Okay, so systemic inhibition of COX-1 will lead to damage of the stomach by the gastric acid and the kidneys, and also they will lead to impaired clotting of blood, because if you cannot form thromboxane A2, there will be no platelet aggregation, so the platelet plug cannot be formed, so there will be impaired clotting, and this is the basis of aspirin's toxicity. Now, also aspirin usually delay birth in both humans and animals. Also, aspirin, but not other NSAIDs, will induce synthesis of lipoxins, which are anti-inflammatory mediators made from arachidonic acid. Also, it will induce synthesis of resolvins and protectins, which are inflammation resolving mediators made from eicosapentaenoic acid, okay, which is an omega-3 fatty acids. Now, inhibitors specific for COX-2, the COXIBs, for example, celecoxib, were designed to reduce pathologic inflammatory processes mediated by COX-2 while maintaining the physiologic functions of COX-1. However, their use has been associated to increased risk of heart attacks. Okay, how do they do that? Because they inhibit COX-2 in the endothelium, and so there will be no formation of prostacyclins. So if no prostacyclins is formed, thromboxane will lead to, so the thromboxane action will be unopposed. So there will be vasoconstriction and platelet aggregation. So there will be thrombi formation. Okay, and this thrombi can occlude the coronary arteries into a heart attack. Okay, so some even have been withdrawn from the market because of this risk. Now, this is aspirin, your acetylated salicylic acid. Okay, so it usually acetylates a serine group, a serine side chain in the COX-1 and COX-2. Okay, irreversibly. Okay, hence inhibiting the enzyme. Now, thromboxane and prostaglandin in patent homeostasis, if you have been keenly listening and you have reached at this point, you must have an idea. Now, thromboxane A2 is produced by COX-1 in activated platelets. And thromboxane A2 will promote platelet adhesion and aggregation and contraction of vascular smooth muscles. And this will promote formation of blood clots, the thrombi. let me not say blood clots and thrombi are the same thing. So blood clots, okay? A clot forms at the site of injury, a thrombi formed in uninjured vessels, uninjured, a vessel which is not injured. A thrombi is pathologic, but a clot is not pathologic. Now, prostacyclin, PGI2, is produced by COX-2 in the vascular endothelial cells, and it will inhibit platelet aggregation and stimulate vasodilation, and so it will impede thrombogenesis. So you can see the opposing effects of thromboxane A2 and prostacyclin limit thrombi formation to the site of vascular injury. So clots are supposed to form at the site of injury. They are not supposed to form anywhere else. They are not supposed to form in vessels which are not injured. If that occurs, they will form a thrombi. And these thrombi are some are very bad. Okay, they can form a thromboembolus, which can lead to occlusion of vessels, which can lead to sudden death. Now, aspirin has an antithrombogenic effect in that it inhibits thromboxane A2 synthesis by COX-1 in platelets and also prostaglandin synthesis by COX-2 in endothelial cells through the irreversible acetylation of the COX-1 and COX-2. However, COX-1 inhibition cannot be overcome by platelets because they lack a nuclear, hence they cannot transcribe and translate for the formation of another COX-1. But endothelial cells, they have nuclei. So COX-2 inhibition can be overcome because they can transcribe and translate formation of COX-2. Okay. So by doing so, you inhibit COX-1 selectively. So low doses of aspirin can be used to lower the risk of stroke, cerebrovascular accidents, and heart attacks by decreasing formation of thrombi. How? They inhibit COX-1 selectively in low doses. So COX-1, so no thromboxane A2 formation, so there'll be no platelet aggregation, and it will promote prostacyclins will be the one in higher concentration, so there'll be inhibition of platelet aggregation, and there will also be vascular dilation, okay, vessel dilation. Now, here you can see the opposing effects. Please note that this is what I wanted to show you. And these selective, these have been even, some have been withdrawn from the market because now these are very bad because if they inhibit COX-2, COX-1 activity will be high in platelets. So thromboxane A2 will be prevalent, and there will be platelet aggregation leading to thrombi formation, lead to strokes and heart attacks. Now, leukotriene synthesis has come to an end. Now, arachidonic acid is converted to a variety of linear hydroxyperoxy acid by a separate pathway involving a family of lipoxygenases. For example, 5-lipoxygenase will convert arachidonic acid to 5-hydroxyperoxy 6-8-11-14 eicosanoic acid, abbreviated as that. So the 5-hydroxyperoxy eicosanoic acid is converted to a series of leukotrienes containing 4 double bonds. And the nature of the final products will vary according to the tissue. Now, leukotrienes are mediators of allergic response and inflammation, okay, in asthma especially. Now, inhibitors of 5-lipoxygenase, zeroton, and the leukotriene receptor antagonist, montelukast, okay, are some of the drugs used in the treatment of asthma. Note that leukotriene synthesis is inhibited by cortisol. Okay, so the steroidal anti-inflammatory drugs will inhibit leukotriene synthesis, but not by NSAIDs. Remember, NSAIDs will act on the cyclooxygenase. Cyclooxygenase does not lead to the formation of the leukotrienes. Rather, arachidonic acid is acted upon by lipoxygenase. So you need, if you want to inhibit that, you can either inhibit the release of arachidonic acid from the membrane phospholipids by use of the cortisol, which will inhibit phospholipase A2. Now, in some patients with asthma, 10% of individuals with asthma, once they take aspirin, the respiratory disease is usually exacerbated, okay? And this is due to leukotriene overproduction, okay? So remember, aspirin is an NSAID. So if you inhibit the cyclooxygenase, the arachidonic acid will be directed towards the lipoxygenase pathway, and more leukotrienes will be synthesized. So and if you have more leukotrienes, this will lead to broncho constriction. So the respiratory disease will be exacerbated. So here you can see arachidonic acid. So you can prevent both prostaglandins and leukotriene synthesis by use of steroid anti-inflammatory drugs. Then here you have arachidonic acid converted to 5-hydroxyperoxy-eicosanoic acid by the 5-lipoxygenase, which is then converted to leukotriene A4. Okay, yeah. And in the leukocyte platelets, masses, heart and lung, vascular tissues. Then, by the action of leukotriene C4 synthase, a glutathione is added to leukotriene A4 to form leukotriene C4. Then, the glutamate is removed from C4 to form leukotriene D4. Then, a glycine is removed from the D4 to form leukotriene E4. Now, these are known as the cysteine leukotrienes, and the immediate contraction of smooth muscles in the airways leading to bronchial constriction, and in the blood vessels leading to vasoconstriction. They also increase vascular permeability. Okay, so and they are involved in the pathophysiology of asthma and seasonal allergies. So these cysteine leukotrienes, okay, these leukotriene C4, D4, and E4, they make up the slow reacting substance of anaphylaxis, which is the is involved in the pathophysiology of asthma. Now, leukotriene B4 is synthesized from leukotriene A4 by the removal of a water molecule by a hydrolase. Then the leukotriene B4 it acts on the immune system in that it is a chemotactic agent for neutrophils, promotes addition of the white blood cells, and the release of lysosomal enzymes from the white blood cells. Okay, so those are the functions of some leukotrienes. So please, this image, put it in your mind. It will help you very much. So we have come to the end. Thank you for your attention, and please subscribe for more anatomy and biochemistry content. And this is the way. Thank you.